Hi class. So today we're going to be talking about cardiovascular disease like heart diseases and stuff like that. There are a lot of cardiovascular diseases and the number one risk for the of developing heart disease is like lifestyle factors. That's like one main one, like if you smoke, have a poor diet, physical inactivity and excessive alcohol can cause heart disease. There's also genetic heart disease, and that's something like even if you like you're the healthiest person ever, but you someone in your family had it. Sometimes it skips generations. Sometimes like the next person has it. For example, my sister is the first one in our family to have epilepsy because of a traumatic brain injury. But then she gave birth to my two nephews, and both of them have it. And the oldest one is like 14, and the other one is 6 or 7. And they still had to be treated at Children's Mercy. It's the same with heart diseases. Like, if they're hereditary, you can have it even if you do your best to not have to be healthy and all that. It could happen to you just because somebody in your family had it before, or it might not be you and you're completely healthy, but then your kids could have it. Okay. And then uh, major causes for causes of cardiovascular disease is the restricting blood flow to vital narrow arteries, that's restricting blood flow to vital organs, blood clots, endothelial damage, that's chronic inflammation or high blood pressure damaging the vessels lining. Some other diseases that can cause a heart disease or diabetes, high blood pressure, which everybody considers high blood pressure the silent killer. Sorry about my dog. The silent killer, because like you can say you feel fine, but your blood pressure is like extremely high. And another main one is diabetes. And cholesterol is another one that you might look into it. And nowadays people, like a lot of people have diabetes. Even if you're healthy, even if you do all the right things, you could end up with diabetes. And I seen videos of people who are like extremely healthy. They work out, they eat their vegetables, they have a good diet, and they still end up with diabetes. And like high blood pressure or and cholesterol too. And some people think that it's not that big of a deal, and that oh my god, it's just diabetes, I'll be taking medication. Or hey, now we have the GLP-1 to control your diabetes, your hungriness, and everybody thinks like, oh, I have diabetes, my insurance will surely pay for my GLP-1, and like I get to lose weight. But it's not just that. We gotta consider the factors of what comes with diabetes or high blood pressure, because it's not just you're needing medication. Because like if you have that disease, you're gonna end up having little ones that overall are gonna affect your body. And one way to prevent this is to start smoking for one, to have a healthy diet, and do some style changes in general that could can lead to good results. Because like People just think, oh, I have diabetes, it's no big deal, I'll just take care of myself and I should be fine, take my medication on time. But they don't know the risk of that comes with diabetes, and it can be like damaging. And when communicating with patients as a nurse, like, I think the first thing I will do is try to guide them into the right place to go, like to try to guide them so they can see a nutritionist that can help them with their diet and their exercise. Give them options. If they smoke, give them options of how to stop smoking, because that's like a major thing that you need to stop doing if you want to like change your life and control your heart disease. I will avoid medical terms, and I will just try to guide in the right direction. I will also have empathy and listen to them, because some people just want to be here, and us as nurses, we have that responsibility to us as future nurses, we have that responsibility to hear them. Even if you're a CNA or CMA or LPN or N or anything, even a doctor, your responsibility is to listen to them. Not just be like, oh, you're gonna go into this medication without explaining it and just saying, oh, it's for high blood pressure or for diabetes. No, you have to listen and answer their concerns to the best of your ability. Okay, I will give them brochures. Like, the hospitals always have brochures, or like every medical facility has brochures about things like this. I will also try to motivate them to change their lifestyle, learn more about whatever heart disease they have or whatever sickness they have, because the more they know, the better they can tackle it and get better. And sometimes it's not just about like you trying to get better, it's about your family, trying to do it for your family. If you have kids or a husband or mom, dad, you just want to try to get better. And as nurses, we had to guide them into the right direction, so they understand that it can get better with a few changes. Okay, that's it. Bye, class.